Hey, good evening, everybody. So, this is Nathan Matheson. Completed the leadership skills questionnaire. Um, to reflect on the findings, I'll actually give you my scores. Total scores, administrative skill was a 24, which was high. Interpersonal skills were a 26, which were very high. You can smile on that one. Conceptual skill was 21, also high, but at the was on the lower end. And that, in thinking about what that was, critical thinking, abstract and complex situations, who likes that? I think to some degree that you have to be able to do it, but nonetheless, probably not anybody's favorite thing to have to deal with. Moving on a little bit, after looking at that, my organizational structure, I am the current manager and supervisor of supplemental staffing and an observation unit at my facility. And the question was, consider how you would function as a manager and as a leader in the organizational structure, and while using the model of care that you reviewed during the practice experience. Looking at my organizational structure, it was kind of interesting, and to be honest with you, I was kind of confused to start with exactly what I was looking at and kind of looking at the test. My organizational structure is tall, vertical, bureaucratic, so to speak, in that you have a chief nursing officer that's at the top of everything. It branches down into what we call service line directors. So you have a director of surgery, you have a director of medical, surgical, telemetry nursing, you have critical care nursing, mother baby. You're broken down into all the different levels. So you can kind of see from there, manager, department heads for all the nursing units are kind of included in there. One thing I thought was interesting about that, the hierarchy of everything. If you look back at our text, it says that there are regularly assigned activities, written directives, policy guidance for behavior. Well, anybody that works in the hospital is full of policy. But definitely that was the one. The vertical seemed to reflect best with my facility. I have to say, I like the model. I think it works. One of the things our text pointed out was that there are communication does tend to get watered down. I believe that to be so. I think the more people you have to go through for something, that the less clear the message is going to be. And I think that's pretty consistent. I think you would see that. I mean, if you think back to being a kid, I had a teacher that made us whisper into the person next to us' ear when all the way around the classroom. Think about it, by the time it got to the end, it wasn't nearly the same. I could see how this would be much the same. You pardon me for the elementary comparison there, but it works. Interestingly enough, the matrix portion of that as well seemed to fit in well. If you look at the hierarchy, whether it's horizontal, whether it's vertical, when you've got a matrix there, it seems like the departments are all working together. Seems to make a better flow for everything. I think at some point you can have a hierarchy. Everybody has to answer to somebody. I'm a firm believer in that. But then at the same time, there are certain situations that you're going to need group input on things. Makes things run better, in my opinion at least, and makes for a much smoother transition when you have problems and new policies and things that you need to work out. Model of care reviewed during the practice experience. I did a little research on my own on this one. Obviously I like team nursing. Team leader makes some assignments, delegates care out. But then you go on to partners in practice. Everybody's working together for the care for the patient. Ideally that is the two things I prefer to see. I think that works well. Excuse me. Also, in looking up, I did some Google searches on some things and found progressive patient care. Now, not so much as the assignment of the nursing, but more as placement of the patients. Your patients are put in places as far as illness, and you kind of see a combination of the three. And I think most hospitals are like this. You have a step-down unit for your step-down patients. Your patients aren't necessarily situated by illness, by sickness. It's on severity. Back to the team nursing partners in practice. Those were the two things that I thought worked well together. If you blended those two, I thought that would definitely make for a good way of caring for your patients. As far as it goes, published literature that I looked up, I actually had an article, National Institute of Health, toward a transdisciplinary model of evidence-based practice. Transdisciplinary model of evidence-based practice. This particular article looked at care not only between medical providers, also nursing, branched into different things, case management, and you really saw a grouping of how all these domains working together with evidence-based practice made things better, made care for the patient better. As it related to medical providers, you had clinical expertise with research evidence and patients' preferences that all if you had three circles, they would all come together into the one. And that same model was mimicked for nursing. But it also, with this, you had three circles, which were clinical state and circumstances, patient preferences and actions, research evidence, and in the middle you had clinical expertise. And one thing that I thought was interesting, with an interdisciplinary approach, it said, we're not trying to make cookie cutter care because nobody's the same, but rather you want to take the research that all of your different groupings, whether that be case management, whether it be nursing and physicians, all bring to the table to put together to provide the absolute best care that we can. So I thought that was a good article. It did bring everything together as far as how the different groups working together seem to provide better care, how that would work. There was a question as to what skills described in Chapter 7 of Grohar, Murray, and Langan and identified on the Leadership Skills Questionnaire would you use to secure needed resources such as staff? I think you go back to the core values. If we think back to the last module, different things that you're going to have to bring in. First of all, I'm a very big proponent. I think that folks want a leader and a manager. I saw something interesting one of the employees at the hospital had this week. It was a difference between a boss and a leader. It showed workers that were pulling, looked like a big block, and there were 3 workers that were pulling it, and for the boss, they were sitting on top of the block and telling them, go, go. Whereas on the bottom one, for a leader, the leader was in front helping to pull it. And I think that was interesting in itself. I think that's one of the qualities that people look for in a leader. I think that to be a good manager, you have to be a leader. Unfortunately, there are folks out there that are managers and not leaders, and not necessarily a good quality. Be it if I was in a higher level management position, again, I would look back to the core values. How would you provide? How would you be effective in your role? Sorry, I'm reading here. How would you be effective in your role? Identify the levels and departments that you would need to work with in order to be effective in your role. I think that, if we think back to what I was saying about the matrix, I think it's very important. You have to know how to work with other departments, and I think whether you're in nursing, if you think about that, you've got to be able to work with a lot of different people. Everybody from dietary to housekeeping to respiratory therapy, radiology. I mean, at the end of the day, we're all in this together, and I think one of the things that managers are there for is to kind of be a bridge between all these places. If you work in a hospital, we don't always all play very well in the sandbox together, so to speak. So I mean, you have to have some sort of a matrix system with everybody working together. Otherwise, you're not going to accomplish anything that you want to. Kind of going back, how would you secure needed resources such as staff? That's where I was kind of going with the core values. I think that the important things, you would look at the different words there. If you looked at recognition, truth, justice, authenticity, wisdom, all the different characteristics that you would see in yourself are the things that you're going to use. I've heard before and been told, people stay on a unit because of a manager. Well, they stay on a unit because of a leader. Folks, interestingly enough, I saw when a unit was changing leadership, and I was sitting in on the meeting, and one of the workers there made the comment, she wanted to be inspired. She wanted to work for somebody that could make her feel like she was doing a good job. I agree with that to a certain extent. I think having a good manager, people will work for a good manager or a good leader. Even if you didn't have necessarily a good manager, if you had good charge nurses that were leaders on the floor, that's the type of thing I think that make people stay and be happy in their job. So that's how I feel about management and how you need to do things to secure those needed resources. You've got to be an advocate for your staff. You've got to think about what they need, what they want, and do everything you can to get them everything that they need. As far as do I have a preference for a vertical or horizontal structure and a particular model and why? Kind of going back to that from earlier, my system in the hospital, I'm used to it. And as we discussed, it's a vertical structure. Again, getting back, communication sometimes gets watered down in that, but I will tell you it works for our facility with our little group. Now, you do see the matrix come out and things. If there's a policy issue, we're doing a root cause analysis, you'll see many groups coming together and working together, and that tends to work out very well. So that's all I've got. Well, I hope everybody has a good night, and we'll see you next time. Thanks.